We have a very special guest, somebody who is a very highly respected expert in a topic Don and I have talked about a lot, which is vagus nerve. Dr. Navaz Habib, welcome. Thank you so much for joining us.
It's an absolute pleasure. I'm excited to be here with you guys.
Thanks, Klaudia. Dr. Habib. So for the audience, I first saw Dr. Habib out at the A4M in Las Vegas in December. He was doing a presentation. We're going to talk about some of the content of the presentation, but he was talking about things that I had not seen before. I believe biohacking is so much of first to find. And I think that's one of the things that we do. Our challenge is application. Our challenge is once we find this device, this symptom, this process, how do we apply it? So, and then we put this in the context. I typically work in the performance area. So if you've seen any of my work, I talk about the fact and the fact that medicine is largely working -10 to 0. There's symptoms, -10, you're dead. 0, we're existing on earth here. We're moving around without symptoms, thinking life is fine. But then there's 0 to 10. That's where performance is at. And so much of that we've learned that HRV is this unique identifier. It's this unique variable that runs the gamut. It runs from the top of my Olympians all the way down to people who are getting ready to transition to the next world. So as we start to work through this and we discuss that range, one of the things I saw in your presentation that really got my attention was you were talking about transcarotid vagal nerve stimulation. And for our audience, we're going to use this term a lot. So there's a little sensor. In fact, I'll grab one here in my bag. I should have had it up here, that you put on the carotid sheath or the carotid artery on your neck, and it sends a little electrical signal in which stimulates the vagus nerve. What is the result of that? And the thing that really got my attention, Dr. Habib, was TBI, the role of transcarotid vagal nerve stimulation in treating concussion and symptomatics all the way up to traumatic brain injury. Can you spend a little bit of time talking about that, what your experience there is, and how that has changed the way you practice medicine?
Vagus nerve is a cranial nerve. We've got 12 pairs of cranial nerves, and 11 of those nerves stay in the head and neck area, but one leaves, and that's the vagus nerve. And we call it the vagus nerve, bit of a misnomer. We have 2 of them. What's unique about the vagus nerve, in addition to its anatomical structure, is the fact that it literally physically connects to virtually every single visceral organ that we have. There is a direct vagus nerve connection to the lungs, to the heart, to the stomach, small intestine, pancreas, kidneys, liver, gallbladder, you name it. Every organ has a direct physical connection via the vagus nerve. But because this nerve went to so many different organs that have so many different unique functions, there wasn't a true understanding as to what was going on. So histologically, we identified finally about 20 years ago that it's the immune system. The immune system cells that are present in every organ of the body are the driving factor here. So what happens in the liver needs to get signaled up to the brain. What happens in the gut, what happens in the heart, what happens in the lungs, that information via the immune system checking to see, constantly checking status, is going to send its status updates up to the brain via the vagus nerve. 80% of the signaling on the vagus nerve is afferent, meaning it's going from the organs to the brain. So that's where vagus nerve comes in, is the vast majority of that information needs to pass through this nerve. And just like every other nerve, it conducts information via electrical impulses. So these electrical pulses that are going through the nerve endogenously, just how we signal, so how effective the electrical signals go through the nerve is how effective is the nerve in signaling. So you all know if you have a USB wire that's supposed to be charging your cell phone and it's all frayed on one end and it's kind of bent and broken, it's not going to have as much signaling capacity. We're not going to get the electricity through that wire effectively, versus a nice, strong, thick, brand new, amazing wire the signal is going to pass very, very quickly. So in the ideal world, what we're trying to do is make our vagus nerve into that thick, strong, functional electrical signaling pathway for this information to go from the organs to the brain, and then the 15% of information to then make its way down to the rest of those organs. But now in terms of electrical signaling capacity, there are things that we need to do to initiate the vagus nerve to be capable of sending those signals electrically. The breath is the major piece to this puzzle, but a lot of people are not breathing effectively. The reason why tools like Truvaga vagus nerve stimulation devices work as well as they do, and we'll get into kind of the science behind them, is they're augmenting the electrical signaling capacity of the vagus nerve to get those signals up and running. It's actually healing and thickening and strengthening the vagal tone if you do this consistently. Now, we don't all need an electrical stimulator, but in the context of TBI, in the context of major inflammatory issues, let's say, for example, a traumatic brain injury where on the field somebody gets hit. I was watching the Jays game yesterday, and one of our players got a pitch to the head, like helmet thankfully was on, and it hit his shoulder first, but like a direct hit to the head by a 96-mile-an-hour fastball is what happened yesterday. Immediately what's going to happen is the tissue-resident macrophages and the immune cells within the brain, within the head area, these are the microglial cells, are going to go into fight mode because they need to stop the bleeding. They need to ensure that any damage, any physical damage that's occurred is going to be effective in knocking out the threat to survival, okay? And so they go into this fight mode. They go into, let's go inflame this issue. Let's make sure that the damage is minimized. And let's make sure that we put out the fire, essentially, is the key here. Let's put out the fire. We need the firemen to come in. The microglial cells go into that mode. But if we don't have good vagus nerve signaling, those firemen remain for too long. And once the fire is put out, we don't need the firemen anymore. We need the firemen to switch into the builders, the fixers, the welders, the electricians, the carpenters, the maintenance staff of the brain. And it's the job of acetylcholine to create that shift. And so when vagus nerve signals work, even coming up into the brain, as we said, 80% of these signals on the nerve are coming up to the brain. Acetylcholine needs to be released within the brain to initiate that shift to fix mode. And it changes those firefighters into those welders and carpenters and maintenance staff that need to be there. What we're seeing is electrical stimulation of the vagus nerve has the power to turn on that fix mode as quickly as possible and slow down the damage that's done through a TBI type of pattern, right? What it's doing is it's essentially minimizing the amount of damage that the firefighters are doing, blocking it off, and initiating the repair process to stop that breakdown process from occurring. So what, Don, the study that you're referring to literally had 3 different brains shown on the slide. You could see they had one that was a control, and you could see the physical damage on the brain that was done and just how much of the brain had broken down. And then the next one over, they had done 5 2-minute stimulations on the cervical trunk of the vagus nerve and had significantly less breakdown of the brain. You could still see there was a bit of an indentation, but the amount of repair that had occurred was significantly better. And then they had another one that was 5 2-by-2-minute stimulations, so 5 4-minute stimulations, and you could see that there was a very clear dose-dependent response that third brain had essentially healed 80 to 90%. Very little of that brain was actually broken down.
See, this is and for me, someone who's been in sport performance now for well over going on 50 years, this is the first time I've seen the therapeutic application of a technique that actually leads to healing in the brain. And so one of the big frustrations in sport for both athletes and their parents and the coaches is concussion management. Someone goes out and gets their bell rung, and there's recently been updates to, 10 years ago, literally we're telling kids stay in a dark room, don't look at screens. It was relatively archaic recommendations. Now we're starting the same way we've walked away from Rice on injuries now. We're now starting to update, and it's very much the same with head injuries. You're the medical professional here. I want to make sure that I'm interpreting this right. If I have an athlete that is concussed, it's in that athlete's best interest, based on the research that we have right now, to do vagal nerve stimulation, because the evidence suggests that that's going to improve rehabilitation. It's going to speed it up and improve the level of rehabilitation.
I would say without a doubt that is absolutely 100% true, and we should ideally have a stim device on the sidelines of every single sporting event that is happening.
Wow, I hadn't thought about it that far, but put it on the sidelines. I love that. You mentioned something in there, and we were talking about acetylcholine being the primary neurotransmitter of the vagal nerve. Dr. Habib, does it make sense to supplement acetylcholine or choline?
Yeah, choline, yes. So absolutely. Very interesting piece of data. About 90% of American diets are deficient in choline. It's not an essential nutrient, but we won't produce a lot endogenously. We can, but we don't. And our diets play a massive role in this. So I would say yes, without a doubt, supplementation, particularly if there's a brain injury or some sort of cognitive dysfunction that is going on. I found phosphatidylcholine is the best way to get choline in. From a cost perspective, the best way to do this, sunflower lecithin. It is like cheap for that supplement. You can get a bottle of 120 capsules for like $12, and sunflower lecithin contains pure phosphatidylcholine, dirt cheap, great way to get the choline in.
Okay, so
Gold.
So we've gone through this. An athlete takes a shot. Their bell is rung. They've probably been diagnosed with a concussion. And even if they've not been diagnosed with a concussion, if there was an event as a performance person, either as the head coach, the assistant coach, or the strength and conditioning coach, someone should be looking at that athlete and saying, hey, let's get some therapy in here. The same way that we may do a cold plunge or a sauna after a workout. This is just an additive therapy that should, and you're saying have it on the sideline, which I love on that, by the way. Now, we're now flirting in 0 to -10 range. This is a therapeutically diagnosed injury that a medical professional is engaged in. As a trainer, strength coach, assistant coach, head coach on the sideline, we clear athletes return to play based on symptoms. And what we've learned, I know you've seen it with your work with HRV studies. I know I've seen it. I can have an athlete with an injury who is asymptomatic, but their HRV still has not returned to their normal. And this goes on, this can be an extended period of time. We've seen it for maybe up to a year in ACL reconstructions, things like that. So it makes sense as the coach that even though my athlete's been cleared return to play, we don't say that athlete is optimized at this point. There's still work to do. Yeah. Now, let's go from 0 to 10. Someone out there working in the industry, dealing with some brain fog, not bringing it all together. This is the same symptomatic diagnosis that we have with injury. Isn't that correct? That we're dealing with the same combination of issues, transmitters, our brain is, we don't use that term, our brain is on fire, and it makes sense that we get into a process of supplementation and practice to improve that. So when someone comes to me and they're trying to rehab from injury, and again, I respect the physician return to play line. I mean, you don't pass that line. The physician is in charge when there's a diagnosis. But once that athlete has been cleared to return to play, you now step into my world. And so one of the things that's a regular recommendation for me is if I have this, I'm recommended creatine, probably 10 milligrams a day, because with that fire in the brain, we get the impact. We've got inflammation. That inflammation is probably coming from the mitochondria, from electron transport, from glucose metabolism, which is throwing off a lot of the reactive oxygen species, causing the inflammation. So I want to lower the impact of glucose metabolism as much as I can in this situation. So I'm supplementing
100%.
creatine. I'm
Yep.
also supplementing ketone bodies.
Yep.
So, and I'm probably with this person coming with the recommendation to supplement SPM, specialized pro-resolving
Yep.
mediators, to help clear out the inflammation. So what I just heard from you is that combination that we have there, I need to add probably some sunflower lecithin to get the choline in there as well. Is there something else you would add to that list?
You're on track with all of those. All of the factors that you've plugged in there are meant to control inflammation. The underlying pathophysiology between somebody who's just experiencing some brain fog, and I said just, which I shouldn't. Brain fog
Right.
is a direct sign of neurodegeneration. It's just a longer timeline. But in these concussion and TBI type situations, we're talking about the same pathophysiological process, but in a longer or in a shorter time period, in an acute, significant time period. So yes, absolutely. Pathophysiologically, the goal is we want to slow down the inflammatory process. Inflammation is necessary. I want to make sure that people understand this. Inflammation is not a bad thing. Without inflammation, we wouldn't be able to respond to threats around us. But it needs to be controlled. Control is the key, and it's the role of the vagus nerve to initiate that control of inflammation, and it needs to have enough nutrients around to enable that control to occur. So you're 100% on track. Creatine, phenomenal for cognitive function, for anti-inflammatory function, enabling that protein that's necessary for the repair process to take place, to physically have building blocks for protein of the brain and for the body, muscle in particular. Next thing, you mentioned the SPMs.
Ketones.
I believe that was ketones.
Yep.
One big thing people don't realize is carbohydrates are a direct trigger towards an inflammatory pathway. Not to say that carbs are bad, but too much carbs in times when you're not physically active are going to trigger mitochondrial dysfunction. The key here is we have two sets of fuel that our mitochondria can use, either fats or carbs. And if we're doing carbs, we're actually increasing the number of reactive oxygen species. We're increasing the amount of waste product that is produced within the mitochondria and affecting the cell. And we clean it up. And athletes are really good at this. They carb load and they burn through the carb, and it's not such a big deal. But most people that aren't super active, if they're utilizing carbohydrates, they're not earning them. The carbs are then getting stored. And that's where a lot of obesity and adipose tissue and weight issues are actually popping up, is the amount of carbohydrate is not linked to the activity level. Carbs have to be earned. Right?
Well,
Movement
and
is the
let's
key to earning carbohydrates.
let's talk about that
in
for a
those
second.
injury situations, I would shift. Yeah, for sure.
Let's talk about it for a second, because we spent on our podcast, we spend a lot of time talking about the environment. What is the environment pushing on us? And the environment of sport is dominated by carbohydrate drinks. Okay. And we have convinced athletes across the world that you can't function unless you've had this glucose. And frankly, we're way past the point of diminishing returns. We're into a negative space. But the problem is the sideline is dominated with that thought process. I mean, every water jug has a logo on it of a company that sells glucose infused drinks. So this is part of the pressure. So this is where ketones come into play. That ketone energies come into play. These become that acetyl-CoA that we talked about a little bit ago. What do you think about adding into our stack N-acetylcysteine?
Yeah, great tool as well. On the ketone side, I just want to point to, if you can shift in those acute TBI therapeutic times into a ketogenic diet, the healing process is going to be far better. You can produce your own endogenous ketones, and you can supplement with ketones as well. Now, on getting rid of those reactive oxygen species, what we're looking for is oxidative stress reducers. These are antioxidants. Antioxidants, dietarily, berries are a phenomenal source. Blueberries are a great way to get resveratrol and other things in. You're talking about N-acetylcysteine, we're talking glutathione. N-acetylcysteine, glutamine, and glycine, those three amino acids build glutathione. Glutathione is the strongest antioxidant present within the body that gets rid of these reactive oxygen species effectively. The second thing is melatonin. Melatonin is so powerful. Melatonin is not simply the sleep hormone. That is a complete misnomer. Yes, melatonin increases as we go into that sleep mode, but melatonin has significant reactive oxygen species reduction capabilities, like beyond everything else, and it goes into the mitochondria. So glutathione, melatonin go into the mitochondria and actually heal the mitochondria, which is key to full performance. High cellular performance needs repair and recovery. So post-exercise, post-injury, you want to really work on your sleep patterning with your melatonin to support that. So getting out in the sunlight during the day and then complete darkness at night to initiate that serotonin to melatonin conversion to occur, and supplementing N-acetylcysteine, but I'm also a fan of glycine. A lot of people don't get enough glycine in as well. So I'm a big fan of either direct glutathione or NAC glutamine glycine combo is a great way to ensure that you have all of the building blocks to build your own glutathione internally. So I would put those together for sure.
Good.
I love how you mentioned, I just wanted to bring up with glycine. I was reading a few studies, I think a few months ago, with regards to glycine, how powerful just 2 to 3 grams of glycine at night can enhance sleep quality. And not only that, even if you don't get a full night of sleep, the alertness, the lack of brain fog in the morning, glycine is a very powerful supplement to have in your arsenal if you're dealing with any type of sleep issues. So I love that you mentioned that. And yeah, very cool.
In your talk that you did, there was a reference in there to transcutaneous vagal nerve stimulation, improving cognitive performance under sleep deprivation environments. Yes. And we also have several studies out there that show sleep-deprived athletes are roughly 1.7 times more likely to experience an injury, whether that's a concussion or a popped ACL or something like that, than someone who is not sleep-deprived. So we're now looking at, and is there a college athlete that's not sleep-deprived? But, and then let's go one more step on this, is that athletes who have been concussed, the data shows that they are also 1.5 to 1.7 times more likely to re-injure within 2 years after the concussion. So we go back to the beginning of our conversation that while we may be symptomatically ready to return to play, our body or our nervous system may not have reached that point of equilibrium. And so we need to pay attention to this as coaches, as trainers. You know, Dr. Habib, I've made this recommendation to several coaches, college coaches. I said the first thing I would do if I was running a college program is when my kids come in, I would put an Oura ring on them. 100%. Number one, to do 2 things. One, I want to get baseline data. I want to get pre-injury data. You can't get that. Once a kid's concussed, we don't know where we're working from. But if I've got pre-injury data, both on whether it's a popped ACL or a concussion, I now have really interesting it's not return to play, but it's lower my stress level as it relates to, am I going to hurt this kid? What do we train? So this is all tied together, isn't it? And it's all tied together through the vagal nerve.
It is. You're 100% on track there. You need a baseline. You need to know where you're going, where the goal is, right? So I love what you mentioned earlier, that the medical system, physicians have a really good track record of getting people from that -3, -4 to 0. And then once 0 is asymptomatic, but not high performing. And your job as a trainer, as a kind of biohacking coach, is to push from 0 to 10. You want to get as close to that 10 point as you can, because that's the highest performing person that you're going to experience. The key thing that person that's at that 7, 8, 9, 10 region is capable of doing is shifting their state on demand. Being able to shift their nervous system state between sympathetic and parasympathetic on demand. They're able to recover because they have a process to enable that shift to occur effectively. If you're stuck at 0, you don't have that. Most people that are walking around don't have that capability, right? The nervous system regulation piece is the single biggest driver of your performance capacity and your ability to enter a healing state. We can't heal if we're stuck in sympathetic. And those people that are coming back asymptomatic, but not yet at the level where they want to perform like they used to, they're coming back stuck in that sympathetic state. And what's showing up is low HRV still. That's what you're seeing because symptoms are not there. They don't have the severe brain fog, the visual aura disturbance. They don't have the cloudiness. They don't have the digestive issues quite so much anymore, even though I'm sure they're probably missing some of those.
I agree.
Because gut brain is a huge piece and really not thought about. What we're seeing, what you're noticing is as HRV remains low, that means their body is stuck in that sympathetic mode. Sympathetic mode from the nervous system is fight or flight, right? But that fight or flight signals that's going out via the nervous system goes to the immune system and turns on fight mode. It signals to the immune system, to those immune cells, to become the firefighter again. And what that does is it pushes those cells into inflamed state. And that's why the injury-prone capability or the re-injury situation is so high, is because they're essentially running blind in a sympathetic state and they're not able to regulate and push their state back to parasympathetic when necessary. And parasympathetic is rest and digest on the nervous system side and recover on the immune system side. And heal and fix. And so it's a matter of can they regulate that? And vagus nerve signaling is key to regulate that. We're not just trying to go parasympathetic. Going full parasympathetic is pushing the brakes on the car and not having an accelerator. You need to have balance between the accelerator, which is the sympathetics, and the brakes, which is the parasympathetics. And you want to be able to do that at a high-performing, on-demand level, and that's where you get to the high-performing 10 person.
So recovery. A lot of times we think of recovery as a bucket that we fill with resources. Do I have energy? Do I have the ability to do this? But rather, recovery is more about the ability to shift my state than anything else.
No question. So you'll only recover, you'll only heal in that parasympathetic state. The recovery process needs to be initiated. So it's a matter of initiating that shift and being able to go between states on demand. So you can't recover while you're in the performance mode. That's sympathetic state. That's necessary performative state. But once the performance state is done, I'll ask you this question. How many of these athletes have massive difficulty getting out of game mode and shifting into sleep or calm or recovery mode? Right? They don't have a process to...
The good ones don't.
Exactly.
Yeah.
So right? The good ones know that they have to have this regulated process to create that shift into recovery mode. The ones that don't understand that tend to be the ones that have a lot more difficulty long-term and performing.
So in your study, you also presented an interesting paper, vagal nerve stimulation induced cognitive enhancement.
Yeah.
There was a couple studies in there, and essentially this came from the elite warrior community. They had people learning second languages, or they had some people examining either radar or photos, and those who did vagal nerve stimulation improved the ability to learn second language. They improved the ability to identify targets, whether on radar or in photos. So when I hear this, I think of a goalie. I think of whether it's a hockey goalie or a lacrosse goalie, and I think about their ability to pick up the target. So much of their success, and listen, goalies change games, okay? If you've got a goalie that's standing on their head, you win Stanley Cups, you win Tewaaraton Awards, you do these kinds of things. So as we move out of the concussed athlete, we move past 0 up into the 0 to 10 group, it makes sense that our college athletes that are already, or high school college pros, that are already under a level of stress that's different than the rest of the general public, sounds to me like I should probably at least start with my goalies on this therapy, at least, let alone going to the rest of the team. Am I missing something here?
Not at all. You're right on track. So the studies you're talking about, there's two different ones that you had referenced. The under sleep deprivation stress, vagus nerve stimulation, improve mental performance, decrease fatigue, and increase capability. That was in a drone operator study. So that was a really interesting one through Dr. Lindsay McIntyre and her group at DARPA. And then there was a second study that showed that vagus nerve stimulation, specifically with this cervical device, there are auricular devices, there are other devices, but specifically with this particular style of device, this was done at the Defense Language Learning Institute in San Diego, where they tested actually against different devices, which was really cool. And they showed that cervical vagus nerve stimulation specifically was the only one to increase language learning speed. So they had two different groups. One was learning Mandarin, one was learning Arabic. The Mandarin group was stimulated, half the group was stimulated with auricular stimulation, and then the Arabic group, half the group was stimulated with cervical stimulation. There was no change between the control group and the auricular stimulation group, which was really interesting on the Mandarin learners. But the cervical stimulation group that was learning Arabic, those that stimulated learned the language 25 to 40% faster, meaning that rather than learn in 5 days, it took them 4 days, and their recall 30 days later was significantly greater than the control group on the Arabic learning group. So what this showed was that there is a direct cognitive improvement that's tied to cervical vagus nerve stimulation. The way that this works is, again, sending those acetylcholine signals up through those 80% afferents to the central nervous system. And here's the key. We tend to think cognition, brain, neurons, right? That the neurons are the cells that create these connections and build out and create and optimize these connections. Yes, the neurons are the ones that do connect, but which cells are going around every single synapse to make sure that the good synapses that are working are strengthened and which synapses are not and broken down? The answer is it's those tissue resident macrophages in the brain. It's the microglial cells. And if those microglial cells are in the inflamed fight state, they're going to break down more of those synaptic connections. They're not going to be good at maintaining good neuronal connection. They're going to be terrible at maintaining and building and strengthening these synaptic connections. The more inflamed those cells are, the more breakdown occurs within the brain, which is literally the process by which brain fog and neurodegeneration occurs based on the timeline. Same exact thing is happening in TBI and in a very acute, short timeline. But if we can shift and get that signaling capacity to enable that vagus nerve to send the acetylcholine and activate those microglial cells into a regulated, fix, and maintain state, that results in cognitive improvement because it's going to maintain and strengthen synaptic signaling even better. Right. That's really key here. Like, I cannot understate just how important, just how much of a linchpin vagus nerve signals are to maintaining and enabling that state shift to occur so you can go between sympathetic, parasympathetic.
And I wanted to gear a little bit toward the speed at which the shift can occur, because you've talked about a couple of minutes stimulation. The device I use, it has 4 minutes stimulation, so a very short duration that you have control over your autonomic nervous system to shift from that stress, fight or flight, to that parasympathetic rest and digest and recover. Why is it so fast?
So it's even actually faster. This is what's crazy. You can shift your state in 3 breaths if you learn to breathe really effectively. Most people have significant difficulty controlling their breath because we're not breathing effectively. A lot of people are breathing through their mouth. Our nose is our breathing tube. Our mouth is our eating tube. We don't have teeth in our nose. We don't have nose hairs in our mouth. We should be breathing through our nose. Yoga, Pilates, they're built on belly breath. And the whole idea is we're breathing using accessory breathing muscles. We're using our chest muscles, our upper back muscles, tight traps, tight rhomboids, upper back muscles, tight neck, headaches. usually because the breathing patterns are poor, and then the mechanics of your performance are going to be poor as well, secondarily. So breath needs to be nasal, needs to be diaphragmatic, belly breaths, and lastly, it needs to have shorter time on inhale, longer time on exhale if you want to go into parasympathetic state. If you want to go into performative state and high-end sympathetic state, you want longer time on inhale. But you can just change that. You can literally go 6 seconds in, 3 seconds out. That's going to put you into a sympathetic state. Or 3 seconds in, 1 second out. Right? That's going to put you into a sympathetic state because there's more time spent on the inhale. And this is noticed and very clearly seen on HRV because breath is what changes your HRV. So when you then shift and you make the inhale shorter and the exhale longer, we're almost doing a sigh of relief. That's a parasympathetic breath. We're going into this, as we exhale, parasympathetic state and creating this pathway to shift our state from sympathetic to parasympathetic simply by adjusting the way that we're using our breath.
So we've spent a lot of time on the podcast talking about HRV, the value of HRV, and how you adjust HRV, and breathing has certainly been part of that. And I think for the novice, it's important to note, don't get caught up in the numbers for the novice. Yeah. I tell people 5 and 5. Start there. And truth be told, if you're doing 5-second inhale, 5-second exhale, that's probably 90% of the game. You're going to get 100%. A great deal of benefit right there. So for the listener, so what we're talking about right now is we're talking about vagal nerve stimulation through breath work, okay? And we can do vagal nerve stimulation. You know, there's a product on the market. My friend Dr. David Rabin uses vibrations and his Apollo Neuro tool. This is a vagal nerve stimulation tool. So its tone is doing this. So for our audience, and we said it at the beginning of the podcast, not everybody needs one of these. Now, I'll tell you, if I'm an athlete and I'm spending $150 on a pair of shoes, this is an easy investment. You know, there's some things that if I really want to get the most out of my game, this is an easy investment. I spent $80 to buy a heart rate monitor so I have data to make decisions with. I spend some money on this so I'm able to improve. But this, in the absence of a good breathing practice, you're leaving money on the table.
Yes, 100%. This is where I was going to go with this point is the breath is the key to all of it because that's where the physiological changes happen. The job of a vagus nerve stimulator, an external device, regardless if it's vibration, electrical stim, ultrasound, whatever your choice is, they're only there to augment the signaling capacity of the vagus nerve. They are there to, while you're doing the breathing pattern, to make sure that the signaling capacity of the vagus nerve is turned back on.
To make sure the wire is not frayed. Make sure the wire is intact so the signals can get back and forth.
Exactly.
Okay, is there a toxic level? Can I vagal nerve stimulate transcarotid too much?
No, funny enough. This technology is built on a therapy that's been around for about 30 years, which is based on epilepsy. So epilepsy was the initial tool or the initial diagnosis in which this tool was utilized, and it was done in an implanted fashion. So vagus nerve stimulation implants go in, they actually have like an electric coil that goes around the vagus nerve in the neck, and then they have a pacemaker style metal attachment that comes down and there's a link inside there. That device in general is on for 1 minute every 5 minutes. And that is a direct electrical vagus nerve stim right on there. What that does is it shuts off epileptic seizures immediately and it keeps them out of that seizure timeline.
Okay. I'll tell you, with some of my really high performers, these are Olympian type competitors, they'll get to where I call it a parasympathetic block, from the standpoint that they're going through practice, their resting heart rates typically drop into the low 40s, maybe the high 30s. Okay, so these are very fit individuals. But we stop getting a sympathetic response from their typical workloads. And you want parasympathetic, sympathetic. You want the cycle to kick in. So with that athlete, this is where I recommend cold plunge. Okay. I'm not a cold plunge for everybody person. I think you have to use it very strategically.
I agree.
But this is where I'll put in cold plunge. I'll say, listen, I want you cold plunging just to break that parasympathetic block that comes with that. That's really so. No toxic level. Do you think there's a point of diminishing returns, or is that all individual?
I think it's individualized. That said, I've not seen any benefit for beyond 5 2-minute stimulations daily, but beyond 10 to 20 minutes, I don't see significant changes.
So for the listener, I want to throw in one more element here, that if you're measuring HRV and you've really gone down the rabbit hole and you're really maybe even measuring it in real time, like using a heart math device or something like that, you can see an adjustment in your RMSSD and you can see an adjustment in your LFHF ratios with breathing. I've not been able to see that with the stimulation, and we had a conversation about this the other day. So it's not something you should look for.
No, absolutely not. The key here is we're working to increase vagal tone. We're not necessarily working to increase HRV with this particular device. That said, there are changes that I have seen, and people that do this consistently will see changes, but it's only because I'm pairing it with the breathing patterns. If you don't pair it with breathing and just expect the stim to do all the work for you and boost your HRV, you're completely missing the point. The job of the stimulator is to support the breath pattern to get better, stronger, faster, easier. But it's the breath that is the key. And then the cold plunge,
I love that.
Humming, chanting, gargling, singing, everything else, it comes down to what you're doing endogenously. We just need some support sometimes to get that signaling pattern. That's where the stim comes in.
That makes a lot of sense, particularly when we're using the analogy of the wire, that the vagal nerve stimulation process improves the wire, but the practice of breathing and the other things that we do to improve, it's enhanced because we have enhanced communication on the vagal nerve.
Period.
Very good. Klaudia, you had a question?
I had just one more question. I know we're coming up to the end, but I know a lot of people are very concerned and interested and curious about gut health. Yeah. And I know it could be a podcast on itself, but how does the vagus nerve and stimulating the vagus nerve and improving vagal tone potentially could improve our gut health and our microbiome health?
There was a crazy study that just came out in Nature, or I believe it might have been Cell. That said, very respected journal, just this past couple months came out with a study showing that people that don't have good microbiome, so essentially they had germ-free mice, and what they found was vagus nerve tone was essentially nil. Like they had virtually no vagus nerve tone because they had no gut bacterial population. The gut microbiome is a direct tie and a direct link. As soon as they inoculated those germ-free mice with gut microbes, immediately vagal tone went up. So to say that gut and vagus nerve and brain connection are connected is a complete misnomer. They are 100% inextricably linked. Like gut microbiome, gut health, gut motility all comes down to vagus nerve signaling and enabling that signaling capacity to occur. The vast majority of the afferent signals that are coming up from the visceral organs up to the brain are from the gut. It's not from the heart, it's not from the lungs, it's not from anywhere else, because 70 to 80% of our immune cells by volume are located in the lining of the gut. That's massive to understand. That's where the immune system gets triggered. That's where all the good stuff comes in, but it's also the spot where the majority of the bad stuff can come in as well. And so we're constantly checking to see, are we needing to be in threat response mode because we have a poor population or a dysbiotic population of bacteria that's present, or are we dealing with increases in breakdown of the gut lining because we have, leaky gut syndrome that's now occurred because somebody's eating too much gluten, or there's genetic susceptibilities to certain foods or whatnot. And that breakdown that occurs triggers the immune system, and that's where the signaling capacity goes up via the vagus nerve to the brain. So when you don't have a good microbiome, when you don't have a good well set, well functioning gut microbe collection, you're not going to get those signals going up via the vagus nerve, and vagal tone is going to decrease massively. So gut health and vagus nerve health, literally one and the same.
Very good.
Thank you.
So,
Very cool.
so as we wrap up, we're almost an hour in here. I guess we're a little over an hour in. We wrap up. So whether I'm an athlete who has been concussed, or I'm an athlete just looking to improve performance, it looks like there's this combination of supplements that might be a good addition, including creatine, ketones, SPMs. You know what? You can almost use a prophylactic application of SPMs in an athlete, because they're naturally driving and for our audience, SPMs are the tools that resolve inflammation. That's what their name comes from. So we need inflammation, but we need inflammation resolved, and that's where that comes into play. N-acetylcysteine,
derived from omega-3 fatty acids, which are key. The omega-3, omega-6 balance is key, and so you want those omega-3s, and SPMs are built from those.
Yeah. So we've talked about N-acetylcysteine, we've talked about melatonin, we've talked about glycine. All good tools to put into your supplement stack for cognitive performance. Now, if I'm the parent of an athlete, my kid comes home and says, I got a concussion today, I'm on the sideline. And the parent wants to do all they can. Do you think going straight to that supplement package is smart, or do you wait for the consulting physician to give you guidance on that?
I would always wait for the physician, just in case. We don't want anybody to go down the path of having a major issue. Remember, if there is a traumatic brain injury that occurs, gut health is going to be the first thing that's negatively impacted. So taking a bunch of supplements when that issue occurs, not right off the bat. I would make sure that you're getting closer to that repair process. That said, if there's one or two that I would go with right off the bat, SPMs would be on the top of my list, and creatine would be number 2. I think those two are so powerful, so helpful in that initial stage of repair, but always follow doctor's directions for sure.
Thanks. Hey, Dr. Habib, I've got a feeling we're going to be doing this a lot more. It is such a pleasure to have you today, and because your perspective is an outlier perspective. Again, as I said at the beginning of the podcast, biohacking is so much about being there first. And then it's on our responsibility to get the news out and tell the story. And you're certainly here first. You've been a huge motivation and educator to me. So I appreciate that, and I'm grateful for that. But as we close up, anything else that you think would be a good little kernel of knowledge that our audience should walk away with?
Yeah, I feel like the audience is full of people that want to perform at a higher level. And so really, truly, it comes down to, can you learn to regulate that nervous system, and on demand push the accelerator when it's necessary, and on demand push the brakes when those are necessary. It's about being in the appropriate state at the appropriate time. And those that are capable of doing that are the highest performing people that we know, right? We know that the people that are capable of performing at the highest levels are able to create that shift as easily and quickly as possible. And if you can do so with your breath, go for it. But there are many tools that can help augment and support this transition capacity, the state shift capacity, that we should be utilizing and that you should look out for, and pick and choose which is best for you. But it's a matter of, can you do this, and can you initiate that process in your body effectively?
Yeah. My good friend, Dr. Ron Garbo, uses the term intentional recovery, that we do intentional training, we do intentional nutritional, we do intentional money things. We've got to make sure we have intentional recovery in our life.
Big time. And recovery is forgotten. It's missed.
Yes.
And I love the reason why I'm super grateful for you for coming in, because a lot of our audience, what we encourage them to do is find ways to boost their resilience, to get that innate resilience up to a point where life happens and we have threats that we need to deal with. So their body is capable of withstanding the punches that keep on coming. And when they're stopped, they can down regulate and get back into that healing state. And that's why I think the messages that you're putting forth with the vagus nerve is so important, because it is such an innate tool that we can upregulate our resilience with and become stronger as we go, whether we are a high performing athlete or just the Olympians of our own lives. There's so many tools, but this seems to be such a easy access, especially if you're starting from those breath work, gargling, humming, singing modalities, and then potentially adding that electrostimulation on top of it. So I am absolutely thrilled that we had this chat.
This was great. I loved it.
Very good.
Guys.
Thank you, Dr. Habib. Klaudia, why don't you finish this up?
All right. Before we wrap up, I did want to ask, where can people find out more about you, your podcast, and all the things that you are putting forth?
Wonderful. It's the Health Upgrade podcast that I do with my co-host JP that I mentioned earlier. You can check out my books. This is the most recent, Upgrade Your Vagus Nerve, which has lots of great tools. I talk a lot about STIM as a great adjunct or add-on tool, and you can find me on Instagram. That's probably the best way to get in touch, at Dr. Navaz Habib. And I have a great free 10-day vagus nerve jumpstart mini course for those that are looking to do that. So feel free to jump on that. It's a free resource. So we'll send the link out. I'll make sure you guys have that.
Thank you. Yeah, we will put all of this in the show notes so our audience can have super easy access to get in touch with you and learn from the resources that you provide. So that's awesome. Thank you so much for the time. You can find me at longevityjournalist.com, and you can find Don at TrainRecoverWin.com. And of course, on all the social media platforms that are out there.
Everybody,
So
I hope you have a great day. Let's keep building this resilience. Let's keep improving our ability to shift states. This is where the great part of life comes from. Shifting, we're going to take punches. The question is the punch going to be distress or is it going to be eustress? That depends on your ability to shift state and take advantage of it. So let's continue to work on that, because I think it makes life better and really gets us towards that 90% healthy goal that we've set for ourselves.
Indeed. Thanks so much, Dr. Habib.
Thank you.
Don.
Okay.